In treating dry eyes, we oftentimes focus on the lids to make sure that they're clean. In addition to lid wipes, lid scrubs, eyelid cleaning methods, there are some methods like BluffX that can be used to clean the eyelids. To teach students the principle of eyelid cleaning, we've come up with one method that we want to share here.
And this is the placement of the actual tip into the Dremel tool there. There's a little button on the side of that Dremel just to open up the actual, what do you call that tip? The chuck.
The chuck.
The chuck that opens up and lets the tip go inside of there. This is soaking the actual tip with an eyelid cleaner. Very commonly, you can really use any that you want. In this case, we're using one that is soaked with a little tea tree oil as well, but any AZCOPT or any lid scrubs are probably appropriate in many of these cases.
And again, there's a very low powered rotary tool that has a pretty low RPM, around 5,000 I believe. It can be stopped easily with a finger, and it rotates sideways so that the upper and lower lid can be cleaned fairly easily without irritating the inside of the lid. If you hold the rotating tool this way, meaning at 90 degrees to the lid, then sometimes the lid can turn and be everted, which can be uncomfortable for the patient.
Yeah, that would be the one caution. Just try to avoid going behind onto the conjunctiva, because that is an uncomfortable sensation and can lead to a little mucus discharge from the patient after the actual procedure.
And usually it only lasts a day or two, but it's still better avoided. So sideways, you don't get into that problem at all. Keeping the eyes closed will protect the eye from any irritation. The lower lid, you can either go, as you can see, from above to kind of go under it, and you can see that little traction on the eyelid that I want to avoid. So I liked what I did on the left eye better than on the right eye.
And that tension, that pulling to the side is very nice to keep that eyelid taut and keep it from being too floppy and loosey-goosey where it's flipping inside out.
Numbing the eyelids is helpful to help with the itching, and the best thing that you can describe is like it tickles a lot. Doesn't hurt. This is another tip that we found, a micro tip applicator, 2 to 3 millimeters. It has a nice round tip, can also be used sometimes for makeup application. The chuck is open. This has a little lock that then makes this wider so that it fits in there. We want to make it shorter, that the length is easy to use. You can create any length that you want with this little cutting tool that we showed you, and this allows us to treat each lash individually.
And then once you have the patient positioned at the slit lamp, we found that with the first tip you saw, it was best to be performed outside the slit lamp. Once the smaller size tip is being used, this one is best to be used at the actual slit lamp. So again, ensuring it's nice and tight and ready to go.
And this does not come out. The tip is now married to the tool. This is battery powered, so it can be held in one hand. And here I found that going straight from the front, meaning almost creating a rotation around the lashes that you'll see here in a second, is best to free up any debris that might be stuck there.
And I hope you noticed that hand placement is helpful to try to figure out where do you want your hands to hold the eyelids. In this case, right hand is holding the actual Dremel tool, left hand is holding the eyelid tot for this left lower lid. And this is just going along each individual lash along the lash margin and getting it nice and clean.
And any debris, any sleeves, any collarettes that you might have can be cleared off fairly easily this way. The lower lid and upper lid. Lower lid, easier because patients are tolerated this better. The upper lid, more difficult, but better protected because the patient can just close the lids, and thus makes it less likely to irritate the eye itself.
Between each lid, you can re-moisten the actual cotton tip with whatever lid wipe that you're using for this particular case. And this is going along the upper lid now with the left eye, getting it nice and clean.
And then similarly in the lower lid, you can see it already leads to some tearing. Again, initially there's some irritation that tends to go away within probably less than an hour, I would say, after.
And here's the patient's right eye, left hand holding the actual Dremel tool, right hand being used for the actual eyelid fixation. And we can get back in the slit lamp and take a look at what that looks like going along the upper lid.
And you can see the upper lid kind of overrides the lower lid, making sure that even if the upper lid gets lifted up, the cornea is protected. And again, each individual lash can be treated separately this way, getting in between, and it's an additional treatment process to just the gross kind of cleaning of the broader tip.
So just to repeat something, was that the patient looking down, or was that asking the patient to just close their eyes?
Close the eyes, absolutely, yes.
And I think that gives a very nice position with that overlap like we just heard about. And finishing with the right lower lid, and we're just about done with this patient's treatment, and they're looking nice and clean now.
One more touch, because I wasn't happy with the lateral portion of the lid. And again, you can repeat this, you can change the tips if you want. All these tips that we use are disposables and single use, and you can use for each eyelid one tip. You can use one tip for the whole patient, depending on what your preferences are.